Health organizations around the world are taking stricter approaches to alcohol consumption, advising people that no amount of alcohol is safe. Now, that messaging has many in the Pacific Northwest's wine community worried about the future of their industry.
So, wine experts are tackling this topic. We've got one in from Germany who is going to be speaking at Linfield University in McMinnville about how this attitude could be affecting the industry and beyond. We are thrilled to have her here with us this morning. Before her talk, please welcome Felicity Carter, editorial director at Oregonians Global, a think tank focused on the future of wine. Felicity, thanks for being here.
It's great to be here. Thank you for having me.
This is an interesting topic.
Yeah, such an interesting topic, particularly here in Oregon and Washington and California, places that have a pretty big industry. Tell us a little bit about your background and some of the things that Oregonians is focused on.
So I'm Australian, as you can tell by my accent. I've worked for I went to Germany to work for a German publishing house specialising in wine and spirits. So I've been a wine business reporter for about 20 years, reporting on the globe and looking at what's happening. And so this is of enormous interest.
Absolutely.
Makes sense. I can see how it makes an immediate impact on the wine industry. But what exactly is that impact? Again, the World Health Organization talking about this messaging around wine. Maybe just describe what that message is and the correlation to the wine industry here in the Pacific Northwest.
So what I've been doing is looking at the WHO and why they're saying what they're doing. And the WHO, the alcohol unit, which is in Copenhagen, is not the entirety of the WHO. It's just one part of it. But they've become increasingly activist in the last couple of years. And what I discovered was that some of their partners that they write policy documents with are temperance groups. So this No Safe message which is coming out is coming out post-COVID, where people are worried a lot more about their health and so on. But so the impact on the wine industry has been enormous.
Yeah.
You know, I live in a wine region and automatically people started giving up drinking.
Wow.
Yeah, we've been talking about it here as well. And I know I will have to check a little bit of my own personal bias around wine at the door, being something that I do enjoy very much. But I think it's interesting. One of the things that first struck me when this messaging came out from the WHO was just how broad of a brush it appeared to paint on things. And so I'm curious, within the industry, what are we working around? Because when you look at wine versus beer versus, hard liquor and all the various ways that you can consume all of these types of alcohol, it would seem to me that maybe things aren't so same across the board.
No, the state of alcohol research is not very good. It's very difficult to get grants to study alcohol, and certainly you can't study the positive effects of alcohol. But there's very little research on the different types of alcohols and how they affect you. There is some research out of Europe that was published in December that says if you drink wine with food, it has health benefits. But there isn't any comparable research for spirits or beer.
So what is happening now here in 2025 with this messaging from the WHO? What is happening to our wine industry here along the West Coast?
Well, there's a lot of problems in the wine industry, which there's oversupply, there's an ageing population, so they're drinking less and so on. But the no safe level messaging on top of that is having a massive impact, especially among young people who aren't drinking. And I don't want to encourage young people to take up drinking, but it is kind of sad if you're not going to experience the pleasure of the table with a glass of wine.
Right. I think that's some of the nuance in all of this too, and particularly those conversations around nuance can be very difficult to include in conversations around public policy. So, what are we seeing in terms of the impact on public policy this messaging is having?
Well, first of all, you have to know what they mean by no safe level. What they mean is they can't scientifically establish a safe level, which is a different thing from saying that all alcohol is bad for you at all times.
Interesting.
Right? It's like you can't establish a safe level of radiation, but we know that going out in the sun is fine.
Yeah.
So the problem is when a big organisation says things like that is it has huge international repercussions. Countries tend to do what other countries have done. So once a norm is established, other countries will begin to do it as well. And so you are hearing this rising sort of temperance message beginning to happen internationally.
Yeah.
I'm glad you clarified that language, because when you hear no safe level, the way that reads to me means all or nothing. Yep. Absolutely. It means that you can't have any. So I'm glad you clarified that.
Well, we do have a safe level because governments give drinking guidelines. They get scientists to come and sit down every 5 years or every 10 years, depending on the country, to look at what the evidence is. And so the evidence is quite clear at the moment that for men it's 2 drinks a day and for women it's 1 drink a day. That is a safe level of drinking.
Yeah, gosh, it's such an interesting topic and one that we know a lot of folks here in Oregon and Washington are very invested in. You're going to be digging into it a little bit deeper today. If folks want want to join you for your conversation. Tell us about that.
Well, we actually did it last night
Oh,
at
last night,
Linfield
that's right. I'm sorry,
University.
I have my dates wrong.
So people had to listen to me for an hour talk about alcohol control policy. It's not an easy topic. So I was just trying to talk about how alcohol control policy has evolved in the last couple of years since COVID.
Yeah.
It's a fascinating conversation, one that we're glad to have you here weighing in on for folks in McMinnville and our wine community and beyond. Thank you so much
Such a
for being
privilege
here.
to be here.
Yeah, really
we
great to have you
appreciate
here.
it. Well, if you want to learn more about this conversation that continues around safe drinking worldwide and how public health can be affecting the wine industry, check out this story on coin.com.